like to ask you to come with me in a short imaginary travel back in 2003 in a high school classroom. And imagine that by the window, somewhere in the second row, there's a teenage girl. She's staring blankly ahead. She's in silence. She's distant from her classmates. And she's lost in an imaginary world where some good things happen for her. She receives love, attention from a boyfriend who doesn't exist in reality. In that world, imaginary world, she can imagine for long minutes during school breaks or hours during her home, losing track of time. She imagines the smallest details of a life that she's not living. Well, that teenage girl I am that teenage girl. It's myself. And I started dissociating like this when I was around 10. And by high school, these experiences become very, very frequent. And a lot of my free time was in that world, where I was the seen, the loved one, the teenager who received what was missing from my real life. Fast forward, I became a psychologist, I studied a lot, I was trained in CBT at the beginning, so core beliefs were my passion, or I thought they were. Then I continued some trauma work, I did some EMDR therapy, some constellations, compassionate inquiry, and here I am wanting to share something about dissociation, but in fact, in this huge, huge topic, which is at the core of trauma therapy. I mean, if we think about trauma, from my clinical or academic perspective, we need to have something about dissociation there, and this is why I wanted to share, because it's something that I deeply studied, or I was engaged, at least in a certain part of it, but it's also my personal experience. And one that helped me, I think, to be in contact with clients. This is my insight from yesterday during Lizzie's, who was here at Lizzie's presentation? Some of you, okay. She mentioned from the myth of normal, what are the characteristics of the personality of people who get engaged with other people and are the tendency to develop chronic pain, autoimmune diseases, and cancer. I somehow score those characteristics, but in fact, at a certain point, I can easily detach, I can take a step back, and I think that's the reason why I'm not sick and my partner is sick. I'm 41, I'm very healthy from a physical point of view, and that was the insight I gained yesterday, that this kind of dissociation, which never left me, was in fact part of how I managed to survive, and also how I managed to work with people and protect myself. And now coming back to this, because I did some preparation as a very organized and people pleaser. I did some preparation because I wanted to be good enough, I wanted to be lovable, I wanted to do everything that I can so that I can deserve to be here. I have the worthiness to stand up, send a proposal, and be accepted. Well, let's see. This is me. Part of the workshop will mean having some insight of what dissociation is, small insight. Then there are some parts about, I need to focus a little bit, thank you. Some parts about how it is both in clients and us, the therapist, and how we can work with it while in CI sessions. So what dissociation is, how we can recognize it in clients and in therapists, and how to address it using some stepping stones and qualities that I'm sure you all know. From a point of view, the information will not be new. From another, maybe it will open up your curiosity to search into it, to see more about it, and to be in contact with your own strategies of functioning or of being. If during this presentation you feel like something is too much, you feel like you want to get out, or there is a trigger or an activation, please feel free to do it. One of my trainers, while teaching us about trauma, said that we will need a lot of time to hear the same information and not run away from it. So when thinking about dissociation, maybe something can be triggered for you, and I would like to give you the permission to do whatever feels okay for you, whether it's touching or leaving the room, you can do it. And if I can have for some moments a little bit of your attention about the definition part. I cannot talk something that is so bad and it's not so shocking, and it could be in the place and in the heart, in the mind of someone who lives among us. This dissociation, which exists in fact on a spectrum. Not everybody has voices and parts that don't know each other. That's the most extreme part of dissociation. The ones that we might encounter in session is the one with whom we can work, knowing that it might happen. And the experience that we might have during our lifetime, sometimes even we even want to make our dissociation present. The creative tasks, artists, sometimes even athletes can consciously, I might say, but with some question marks about consciousness, want to dissociate in order to create, in order to perform, in order to be there. Sometimes we want it because driving on autopilot is something that we can all do. It's not something dangerous in certain circumstances. And of course, there is the daydreaming, which is part of our, I don't know, our best life, where we can just go into that place and come back. However, if we go from the part of the spectrum which is very normal, I can say, and go to the part that is more trauma-like, things get a little bit more complicated, because it's a survival mechanism that can interfere with our ability to be present and to engage in relationships. That was the worst part of my dissociation back in my teenager years, that I wasn't present for any relationship. And my social anxiety afterwards, I think it was very much connected to getting so familiar with my not being present part, that of course sometimes I'm a teenager when I interact with people, because I didn't interact when I was back in those days. So going back to the trauma field, scientists think about two types of dissociation, and I put them there so that we can have somewhere of a distinction between dissociation that is more adaptive versus a dissociation that is maladaptive. The one that happened during a traumatic event, and one of the most common examples that I heard from my clients is that story when they tell it and they can say, and I saw myself from a distance. I was not there. I saw myself from above. Have you heard about this way of, okay, thank you. And that's the way our brain, our psyche is born. We cannot switch dissociation. We cannot switch survival mechanism, because when we need to, our body, our mind will do things according to the instinct of survival, so that we dissociate from that moment, but we survive. And we can continue. What happens after the trauma ends is that we need some special conditions, we need some resources in order to process what happened, so that it doesn't become a way of living, it doesn't become, it doesn't have a life on its own after the trauma ended. But here is a different discussion, because when trauma ends, someone does not end when the event ends when something happens for us, happens internally, because there's the place where we search for trauma, there's the place where we should search for not being so familiar with this dissociation that might take a life on its own long after trauma has passed. And the effects can be very, very devastating, meaning that there can be a lot of triggers during sessions, during everyday life, triggers that can mean anything, from a question that my therapist might ask me. That could be a trigger for some people to dissociate. Could be some sounds. Here in Bucharest, sometimes there are sounds, we are familiar with sounds, but there are certain sounds that some of my clients associate with an earthquake. It's like, oh my God, your building. My building is sometimes doing some noises. Sounds, there might be questions, there might be internal feelings that can trigger a series of reactions that people might experience, and that could be extremely disturbing, extremely frightening, and make their life, the quality of their life, extremely unwell. And this kind of examples are not connected with people who have multiple personality disorder or DID, this dissociative identity disorder. That's the extreme part of the spectrum. When it comes to normal, regular clients, they might have this experience while being in our practice, in our office, and also we might have these kind of experiences also.